Well, it was year 2015 when the Live, Love, Laugh Foundation started, and that is when Deepika Padukone also opened up about her battle with depression. And it's 2022, there's a lot of progress. Now, if someone talks about mental health issues with their family members, they're not frowned upon, and then they're also no denial. There's a lot of progress, but we're talking about urban home settings. Now, there's a gap that needs to be filled in rural areas, and that is where Live, Love, Laugh Foundation is starting to work, and they're expanding. And with me is board trustee Anant Narayanan and also CEO with us, Anisha Padukone. A very warm welcome to both of you. Now, first of all, what was that one moment where you thought, okay, now we have to expand to rural areas? Did you see any case? What was it?
So I think this was a decision that was made very early on in the journey of Live, Love, Laugh. Mental illness, we all knew that mental illness does not discriminate. It can affect anybody from various socioeconomic backgrounds. And it was important for us while we were doing some amount of work in urban India to also focus on rural India. And that's really where the decision came.
And we're coming to you from Tiruvallur, which is a district around 44 kilometers away from Chennai. And we are in one of the houses that they are visiting, the team is visiting. And Anand, you come with a lot of corporate experience. You've headed a lot of companies. And here, what is your aim? Is it to expand or is it to get corporates into the mental health space?
I think it's a bit of both. I've been associated with the Live, Love, Laugh Foundation, Anisha and Deepika now for about 3 years. I think mental health is an issue that impacts all of us. It's unfortunately an equal opportunity illness, right, that gets to everybody. I think I want to do two things. I think with the foundation and the board, we are trying to scale up. I think we've had incredibly good response early on in many of our pilots. We want to impact more people, but we want to impact them with quality. So I think scaling up our efforts is one big priority. The second is, I think corporate India is waking up finally to mental health issues. I think the pandemic certainly sort of made all of us more aware. So I do want to also use this as an opportunity to get more corporates to actually focus their CSR, focus their funding on mental health, not only because it's an important cause, but because even personally, right, I run Mensa, used to be at Mintra. All of us, I think, by the way, there's a lot of loss of productivity because of mental health as far as and well-being of our employees. So focusing on that is an important deal.
Sure. There are these companies which are also giving these offs to their employees. Latimisho is one of those.
Yes.
And would you encourage more corporates to include steps like these?
I would encourage corporates. Yeah, I think I would say there are three things that I would love for corporates to do. The first is support mental health foundations, whether it's Live, Love, Laugh or otherwise, because I think there's so much work to be done. Second, I think is just awareness and sensitization of employees of mental health. I mean, at Mensa, for example, we have a hotline where people can call and you can get counseling and so on. So I think just being aware is the second thing. And I think the third thing that corporates can do, of course, is I think if you think about insurance, if you think about all of that, making sure that it covers the cost of mental health, because it is actually, even though it's not physical, it's very real. And so making sure that we can deal with all these three will be important.
Right. And also in the NGO space, maybe mental health is still a relatively new space that it is being created. And of course, NL is at the forefront. Is it difficult to get donors or to get, people come forward and support causes like these, or you think things have changed?
I would say it is a challenge for sure in the non-profit sector predominantly, but also in mental health. What has helped is post the pandemic, I think there are a lot more organizations, individuals who either have had an experience or who understand that mental illness is extremely serious. There are 200 million Indians suffering from this, and therefore the need is greater than it was earlier. So we are definitely seeing a lot more support. But having said that, there's still a long way to go, and it's not as sort of accepted as certain other causes in India.
Right. So 65 to 70% of India's population actually stays in rural areas. Hence, it becomes all the more important to support these causes. And then, we've spent an entire day with you guys today. And you visited several rural households, and these are households where you have members who are suffering from some mental health issues. And then you also have local partners here. Can you just take us through what's the aim here? What's the goal that you're trying to achieve with this program, and maybe in future as well here when we talk about Tiruvallur?
Sure. The aim of Tiruvallur project, like our rural program all over the country, is to be able to provide free psychiatric treatment to persons with mental illness, ensure that there is support given to their family members or caregivers. We provide rehabilitation, vocational training. We ensure that there is support provided through, say, access to pension disability cards, opening of bank accounts, Aadhaar cards. So we're really looking at this as a holistic program where we involve different stakeholders who are part of the part of the ecosystem to be able to, over a period of time, perform their functions and ensure that the program is a sustainable model whereby year 5 or year 7, the community is able to take over the ownership of the program. And that is the same sort of plan that we have for Tiruvallur as well.
Sure, you want to say something?
Just one thing to add, I think it's actually more complicated in rural India because I think society, community and mental health, all three sort of come together, much more so than even in urban setting where there's lots more nuclear families, etc. So I think what Anisha said is really important, which is we have taken a community approach so that it's actually something that solves the problem fundamentally, right, over time. Otherwise you can treat the symptoms, but you won't be able to solve the problem. So I think really getting on the ground help, getting the community involved, as you have seen through the day-to-day, is critical, I think, for long-term success of this program, and that's what I think also differentiates what we're doing.
Also, Anisha, there are several celebrities who are working in this space, but we don't see this often that, a big star like Deepika would, visit such small villages, towns. What does it take to get such a big star here in a town like this?
Honestly, not much. She's committed to the cause. It's not just, I can speak, of course, of Live, Love, Laugh. It's not a foundation that she's set up. She's not a foundation that she's just set up. She's very hands-on, as is our board. At the same time, they allow us as a team to function and ensure that, we take care of the day-to-day activities. But I think the passion and commitment, whether it's Deepika or, members on our team, that's really what drives us. As Live, Love, Laugh, we're here to be able to create impact, not just today, but for tomorrow as well.
And keeping your personal relationship aside, is it difficult to work with Deepika Padukone, like with your founder?
I would say that it took a little bit of time. I'm sure, a lot of other people experience that as well in family businesses. So even for us, I think our relationship has evolved over time.
Do you have set rules? Okay, this is not what we discuss, or this is your area, or this is mine?
Absolutely.
What kind of dynamic is it?
Well, one of the first rules I made was in a board meeting, I'm a CEO, so do not, treat me like a little sister. So I mean, jokes apart, I think we've been able to maneuver that. So in the workspace, we engage more professionally, and outside of that, of course, we're just siblings.
Just 30 seconds that I wanted to add to that. I think it's a very professionally run organization. I've been part of several non-profit boards. I mean, I obviously spend more of my time in startups, but a lot of non-profit boards, and I would say it's a very active and committed board. It's very professional. We do lots of impact tracking, which is why now, by the way, more than 60% of the funding actually comes through CSR and corporates, because they can actually see longitudinal impact over time. So I think Anisha and team are doing a fantastic job. But I would say it's actually very far from saying it's a sister. I think she's one of the best people that we have to run such a foundation.
Last question, where do you see LLL going in next 5 years?
I would think 2 or 3 key areas: scaling up the existing programs and initiatives that we have, being able to create long-term impact by working with various stakeholders like the government and creating that impact at a policy level. I really see that as an area that we can influence. And thirdly, to continue the awareness and destigmatizing work that we've started. There's still a very long way to go, and as a country, that mental health conversation has begun. There is a certain amount of awareness, and people are talking about mental health at various levels, but we still have a long way to go, so we're going to continue on that track.
Anything on priority on government intervention front?
Hopefully something soon. We have a couple of things planned, still very initial, but I think the idea is to be able to, like I said, as an organization, utilize our expertise and resources, work with various stakeholders like the government to be able to create impact at the policy level as well.
Well, thank you so very much for both of you for talking to us.
Thank you.
With this, we'll come to an end of this video. From Tiruvallur, Arun Singh signing off with camera person K. Suresh.